Senator Irwin, what is your next request?
I believe we can take questions from the committee.
Does any member of the committee have questions? Senator Black.
Thank you, Mr. Chairman. I had a question on page 2. Maybe, Senator, you can clarify. I want to ask one of the testifying to clarify. It says there on page 2 on line 15, a partner agency of this state shall not implement or enforce any part of the Federal Protection and Affordable Care Act. Then down under 20, it says, on line 20, the department or agency is specifically authorized under existing state legislation, state rules, or some combination of the two to implement or enforce the Federal Patient Protection and Affordable Care Act. I guess I'm just a little confused about to clarify that one. And I do have another question.
Yeah, I think I can speak to that, Senator. This is about the commandeering.
And let me ask, please, that everybody try to keep their remarks as short as they can. Go ahead.
This is about the commandeering issue that I discussed briefly before. The point is that the federal government can do what it wants. It simply can't tell the state government to do certain things. Just like, if the president came down here and started ordering Governor Beebe's staff to do certain things, they'd be entitled to refuse. Governor Beebe's their boss, not the president. And so the idea is that state government can't be commandeered. It can't be ordered around to do these things unless there's state legislative authority. So you want to look at section A there where it says you can't do this unless it's authorized under existing state legislation.
Okay, thank you. Thank you for that. Over on page 3, there on line 8, and I won't read the earlier part of the section, line 1, but at any rate it says the consequences to the state if it does not implement or enable the federal reform enforce, I'm sorry. Do we know what those consequences are at this point?
I can speak to that, Senator, Chairman, members of the committee. The Federal Patient Protection and Affordable Care Act is unlike other federal legislation in that if the state chooses to not implement one piece of it, then the federal government will come in to step in and do it. We've seen that 23 states decided to forego the federal high-risk pool funding. We've seen 5 states reject grants for rate review. States of Florida and Alaska have said they are not sitting on the exchanges. That doesn't mean that healthcare reform doesn't go forward. It just means that it is within the purview of the federal government to do it.
Senator Burnett.
Now, may I also make a comment to that? There are consequences. This report that was given to us in our committee shows that there will be penalties assessed by Medicare for failure to comply by 2015, resulting in a reduced reimbursement for eligible procedures. Those penalties would be assessed to medical providers if they do not comply. There are consequences to not complying with the Federal Patient Protection and Affordable Care Act, not just to our state, but to our citizens as well. And what this report is asking for is a detailed account of exactly what those are.